Okay, so let's get into more of the fun stuff. Um, I mentioned earlier, consumer choice is on the rise. And when we think about, in particular, our Medicare plans, where we're really fighting tooth and nail every single year to retain members. And we know that word of mouth is very strong. We know that this is a population that many times has a lot of time to consider and sift through what benefits are. This is really the place where, in contrast with maybe a commercial population where those decisions about what your plan might be are made at more of a B2B level. When we think about a lot of our members in a Medicare space and the dental plans they're in, there is choice every single year. And so it might not be entirely reacquiring those members, but certainly the mandate to make sure that we're retaining them and servicing them well is a bigger pressure point than it's ever been. So when we think about just the increases in ACA marketplace enrollment, huge volume increases, even just over the last 5 years, and making sure that we're aware of and mindful of that is really how the top plans are going to be able to differentiate themselves. Those plans that when it comes to things like word of mouth, and you think about these members when they're in their social groups, in their community settings, that's where the talk happens. And so the closer we are to some of these consumer experiences, even though we know we're operating in a really different business, even little features or little things that are involved in your plan that are really well communicated can have an outsized kind of impact on those members' likelihood to stick with a plan. So we know some of these data, and just from our own, anecdotal experiences, whether that's how you feel when you're serviced with an issue, if it's going into the Apple store, if it's the expedience of getting something you need from Amazon, if it's the on-demand and personalization of something like a web streaming platform, a Netflix, a Disney Plus, whatever that might be. We know that most of the time members are operating in these worlds. And so when they bridge over to the complexity of a healthcare environment, we might not be able to do exactly what Apple and Amazon and Netflix do, just based on the complexity of what we're managing. But we know that the closer we are to those experiences, we are going to edge out competition. And so it's always how can we be the top of the experiences from what people perceive relative to the rest of the marketplace. We know that members want their experiences to be more personalized. We know that there's an unbelievable amount of fatigue that's just associated with trying to sift through the healthcare industry. And we also know that it's very difficult for most US adults to understand their health insurance. It could be a myriad of different issues, from language barriers to healthcare IQ to literacy rates to purely the complexity of these benefits. The more we can succinctly distill those down, the better likelihood we have of those positive member experiences. Thinking on the medical side of MA, those really positive responses from a member experience in those star ratings. So that's what we're striving for. And I think it's really important that all conversations around engagement strategy really anchor on this idea that we're not trying to do better than we did a year ago. We're trying to achieve as close to a consumer experience as possible, because we know that meeting that expectation is going to create just the most ease for our members in general.